Actually, only a part of the upper limb you are seeing here. Okay. Anyway, so this is the thigh region. Okay. You are able to see the thigh region. Okay. Fine. And this is the head of femur bone. Okay, facing, which is facing medially. Normally, it will be facing medially, right? So this is the lateral side of thigh. Okay. So are you able to see one structure is pinned here? So can you please try to identify the pinned structure here? In idea? Yes. The pinned structure is iliotibial tract. Iliotibial tract. Okay. Fine. So the subcosine for the iliotibial tract. Okay. The subcosine for the iliotibial tract is, it may be attachments. Okay. It may be attachments. Okay. Attachments of the pinned structure. Otherwise, the mention the two muscles attached or inserted into the pinned structure. Okay. Otherwise, what is the function or what is the significance? Okay. Functional significance or function of the pinned structure. Okay. So you can see in this diagram. Let's talk about the answer for the subcosine for all this. Okay, fine. So first question, I told you the attachments or extent of the iliotibial tract, isn't it? So what is the extent? From the name itself, you can easily guess. It is extending from the iliac crust to the upper end of tibia. Okay. So from the iliac crust above to the upper end of tibia. Okay. Below. That is the extent of this green color structure is iliotibial tract. Fine. So this is about the extent. Now coming to the another subcosine, the usually asked subcosine. What are the two muscles, okay, attached or inserted into it? As you see here, gluteus maximus, the major part, 3/4 of the gluteus maximus muscle, and another muscle is tensor fasciae latae. Okay, tensor fasciae latae. Okay, so remember the two muscles attached into the iliotibial tract, major part of gluteus maximus and the tensor fasciae latae. And what is the functional significance of iliotibial tract? Yes, it stabilizes the knee joint. Okay, it is crossing the knee joint and finally gets inserted into upper end of tibia, isn't it? So it stabilizes the knee joint. Okay, during extension as well as partial flexion of knee joint. Okay, at least remember it stabilizes the knee joint during extension as well as partial flexion of knee joint. Fine. So this is about the subcosines for the iliotibial tract. Fine. Okay. Now coming to the next subcosine. Again, you are seeing in this image also the upper part of thigh. Okay, upper part of thigh only, the front anterior part. Okay, upper part of thigh, front of thigh. Okay, so actually here we have one important landmark called as femoral triangle. Actually, it is not seen clearly. Anyway, can you please try to identify one blood vessel which is tied here? Yes, this is the femoral artery. So the tied structure is femoral artery. Fine. Femoral artery is the tied structure. Actually, this is the femoral vein. Okay, femoral vein. So within the femoral triangle, you know the arrangement of structures, neurovascular structures. From medial to lateral, we have femoral vein, femoral artery, and the femoral nerve will be there, which is not seen here. Okay, so femoral vein, femoral artery, and lateral to the femoral artery, we will be having femoral nerve. Fine. So what will be the subcosine for the femoral artery? The subcosine may be extent of the tied structure. Okay. Otherwise, branches of the tied structure and applied aspect of the tied structure. Any one may be a subcosine. Okay. So I hope you know the extent means we can say origin and termination. Okay. Origin and termination of tied structure. Okay. So let's talk about the femoral artery. Origin is it is the continuation of the external iliac artery. Okay, it is the continuation of external iliac artery where, yes, at the midinguinal point. Okay, which is the point midway between AS, and the pubic symphysis. Okay, then course is initially it is passing in the femoral triangle, then it passes in the adductor canal. What about termination? Yes, at the adductor hiatus, the femoral artery continues as popliteal artery, okay, within the popliteal fossa, okay. So this is about the origin and the termination of the what? Femoral artery, okay. So it is the continuation of external iliac artery at the midinguinal point, and finally at the adductor hiatus, it continues as popliteal artery, fine. So it extends from midinguinal point to the adductor hiatus, fine. Now coming to the another subquestion, namely branches of femoral artery, okay. So actually within the femoral triangle, it gives 6 branches. What are the 6 branches of the femoral artery in the femoral triangle? Yes, 3 superficial branches and 3 deep branches. The 3 superficial branches can be remembered as ECE, okay. Superficial epigastric artery, superficial circumflex iliac artery, superficial external pudendal artery, okay. What are the 3 deep branches? Yes, one branch is corresponding to the one of the superficial branches, that is deep external pudendal artery, okay. The other 2 deep branches are, one is muscular branches, another one is profunda femoris, okay. So try to remember the various branches of the femoral artery, 3 superficial and 3 deep branches in the femoral triangle. In the adductor canal, it gives off only one branch, namely descending genicular artery, fine. And I hope you will be knowing the profunda femoris artery is the largest branch of femoral artery. It is the largest branch of femoral artery, okay, fine. Now another subquestion we have, the possible subquestion for the femoral artery is applied aspect of the tied structure. You will be knowing already, okay. So femoral artery pulsations can be felt at the midinguinal point by compressing against the head of femur bone, okay. And another applied aspect of the femoral artery, one is pulsations. What is the site of pulsation? Yes, at the midinguinal point. Another applied aspect of the femoral artery is, actually femoral artery is very superficial, mainly in the upper part of femoral triangle. So it can be used for angiographic studies, okay, by introducing the catheter, okay. So this diagram image shows the site of pulsation, okay, or site of femoral artery palpation, okay, or site of femoral artery pulsation palpate at the midinguinal point. I told you already, okay, fine. And another applied aspect is, so you can see this is the catheter which can be introduced into the femoral artery, okay, for the purpose of angiographic studies, okay, fine. Now coming to the next subquestion, do you see one muscle is pinned here, okay. Actually in this specimen, this is the medial side, this is the lateral side, okay. So are you able to see somewhere here is the origin of the pinned muscle, okay, and this muscle is moving obliquely downwards and medially, okay, fine. And this is the longest muscle in our body, actually longest strap muscle in our body. Can you please identify the muscle pinned here? Yes, the muscle is sartorius, okay. So sartorius muscle has been pinned here, okay. And what will be the subquestion for any muscle? It may be attachments, okay, nerve supply, action, anything may be, okay. Attachments, nerve supply, action, okay, fine. So can you tell me the attachments means origin and insertion, okay. So what about the origin and the insertion of the sartorius muscle? Yes. So see this image showing the sartorius muscle, which is already labeled, okay. So the site of origin of sartorius muscle is from the anterior superior iliac spine, okay. So origin of sartorius is from anterior superior iliac spine, okay. So write it in full form, please, okay. And what about insertion? As I told already, it is running obliquely downwards and medially, then crosses the knee joint, okay, posteriorly. It crosses the knee joint posteriorly and finally gets inserted into the upper part of medial surface of the tibia bone. Upper part of medial surface of tibia, fine, okay. What about the nerve supply? Yes, it is supplied by femoral nerve, specifically anterior division of femoral nerve. And what is the actions of sartorius muscle? Yes, sartorius muscle causes flexion of both hip joint as well as knee joint. right? And for MCQ purpose, remember, it is the longest muscle in our body, approximately 45 centimeter length. Okay. And it is also called as Taylor's muscle. And as you know, the Sartorius muscle forms the lateral boundary of femoral triangle. The Sartorius muscle forms the lateral boundary of femoral triangle, isn't it? So the subcosine for the Sartorius muscle in spotters may be origin and insertion, that is attachments, otherwise nerve supply and actions. Fine. Yes. Now let's move to the next spotter question. Can you please try to identify the muscle which is pinned here? Actually, this is the gluteal region. Okay. This is the gluteal region. Fine. So you are seeing the largest and the most superficial muscle of the gluteal region, namely gluteus maximus. Okay. So the muscle pinned here is gluteus maximus. Okay. So all other structures of the gluteal region, they are under cover of this gluteus maximus muscle. Right? So again, the subcosine may be similar to the Sartorius, attachments, nerve supply, or action. Anything may be subcosine. And another possible subcosine is mention any four or any two structures under cover of, okay, structures under cover of pinned muscle, like that. Okay, structures under cover of pinned muscle. So let's talk about the answer for the subcosines. You know already, it is a large muscle. Okay, it is the largest muscle of gluteal region. So it is having a wide origin. Okay, so it is arising from the posterior surface, dorsal or posterior surface of the ilium bone, then posterior surface of the iliac crust. This is the iliac crust. Okay, so it is arising from posterior surface of ilium bone, posterior surface of the iliac crust, okay, and the posterior surface of the sacrum bone and coccyx bone and the sacrotuberous ligament. Okay, fine. You can see here the origin of the gluteus maximus is dorsal. Dorsal means posterior. Okay, dorsal surface of ilium. If you want to say specifically, behind the posterior gluteal line. Okay, then dorsal segment of iliac crust, dorsal surface of sacrum bone and coccyx bone, then sacrotuberous ligament. Okay. So these are the various sites of origin of gluteus maximus muscle. Okay, dorsal surface of ilium, dorsal surface or dorsal segment of iliac crust, then dorsal surface of the sacrum bone and coccyx bone, then sacrotuberous ligament. Right? Okay. Now coming to the insertion. Okay, what about the insertion of the gluteus maximus? As you see here, the major part of the gluteus maximus, okay, major part, 3/4 of the gluteus maximus muscle is getting inserted where? Yes, into the iliotibial tract. Only 1/4 of the gluteus maximus muscle is getting inserted into the gluteal tuberosity of the femur bone. Fine. So that is about the insertion. Major part is getting inserted into iliotibial tract. Only 1/4. Okay, small part of gluteus maximus is getting inserted into the gluteal tuberosity of femur bone. Fine. Then coming to the nerve supply and actions. Okay, the gluteus maximus is supplied by inferior gluteal nerve. Inferior gluteal nerve. Okay, fine. Then what about the actions? Since this is the largest muscle, main muscle of the gluteal region, which is located behind the knee joint, isn't it? So it is the main extensor of the knee joint. So the gluteus maximus main action is extension of hip joint. Okay, and it also helps for lateral rotation. The main action is extension of hip joint and it also helps for lateral rotation of hip joint. And also remember, for MCQ purpose, the gluteus maximus is the main muscle which is involved during climbing stairs, running, and when you try to stand from sitting position. Okay, so this is the main muscle which is involved during climbing stairs, running, and when you stand from sitting position. Okay, so this is about the origin, insertion, nerve supply, and actions of gluteus maximus. And another possible subcosine I told you for gluteus maximus is mention few structures, any 4 structures under cover of gluteus maximus. Okay, So as you see in this diagram, this red lines, okay, they indicate the outline of gluteus maximus. The gluteus maximus muscle has been removed here in order to expose the structures under cover. Okay. So what are the various muscles you are seeing here under cover of gluteus maximus? Yes, gluteus medius, piriformis, then three small muscles: superior gemellus, obturator internus, inferior gemellus, then quadratus femoris, femoris. Okay. And deep to the gluteus medius, we have one more muscle called as gluteus minimus. Okay. So these are the various muscles under cover of gluteus maximus. Fine. And you can see two ligaments under cover of the gluteus maximus. One is sacrospinous ligament. Another one is sacrotuberous ligament. Sacrospinous ligament, this one. Okay. And another one is sacrotuberous ligament. Okay. And there are some bony landmarks which are under cover of gluteus maximus, like ischial tuberosity, okay, greater trochanter of femur, then sacrum bone. You can see here the sacrum bone, then below the sacrum bone, coccyx bone will be there, okay, ilium bone, and just now I told the greater trochanter of femur, then greater trochanter of femur, ischial tuberosity. This is ischial tuberosity, okay. All these bony landmarks are under cover of gluteus maximus, okay. So you can divide the various structures under cover of gluteus maximus like muscles, bones and ligaments, blood vessels and nerves, bursae. Okay, muscles you know already. The various muscles we have studied already. Okay, gluteus medius, piriformis, superior gemellus, obturator internus, inferior gemellus, quadratus femoris, gluteus minimus, and the origin of hamstring muscles will be also under cover of gluteus maximus. Origin of hamstring muscles, because they arise from the ischial tuberosity. What about the bones under cover of gluteus maximus? I told, okay, whatever bones which are giving origin to the gluteus maximus, like dorsal surface of ilium bone, sacrum bone, coccyx bone, then ischial tuberosity and greater trochanter of femur bone. Then two ligaments under cover of gluteus maximus are sacrospinous ligament and sacrotuberous ligament. Okay, what about the blood vessels and nerves? Yes, superior gluteal nerve and vessels, inferior gluteal nerve and vessels, then pin structures. You will be knowing what do you mean by pin, PIN, isn't it? Pudendal nerve, internal pudendal vessels, nerve to obturator internus. Okay, then three more nerves also under cover of gluteus maximus: sciatic nerve, posterior cutaneous nerve of thigh, nerve to quadratus femoris. Right? And if possible, try to remember the bursae under cover of gluteus maximus: trochanteric bursa, ischial bursa, gluteofemoral bursa. Okay, fine. So try to remember the various structures under cover of gluteus maximus. Okay. For spotters, if you mention any four muscles, that will be sufficient. Okay, for spotters. And it is important short notes also. What are the various structures under cover of gluteus maximus? Right? So this is a simple diagram for the structures under cover of gluteus maximus. You are able to see the hip joint. Okay. So whatever structures which are located behind the hip joint, posterior to the hip joint, will be related to the gluteal region. So you are able to see the largest muscle and the most superficial muscle of the gluteal region we have drawn here. That is gluteus maximus. Okay. So just deep to the gluteus maximus, from above downwards, do you see from above downwards? Do you see the gluteus medius? Then below piriformis, below the three small muscles, superior gemellus, obturator internus, inferior gemellus. Even below that we have quadratus femoris. Okay, quadratus femoris. Okay, and deep to the gluteus medius, we have one more small muscle called as gluteus minimus. Right? Then just above the piriformis, do you see the superior gluteal nerve and vessels? And just below the piriformis, you are able to see the inferior gluteal nerve and vessels. Okay. So as you see, inferior gluteal nerve is on the way to supply the gluteus maximus muscle. Superior gluteal nerve actually supplies three muscles. What are the three muscles supplied by superior gluteal nerve? Yes, gluteus medius, gluteus minimus, and the tensor fasciae latae. Okay. So this is the diagram for the structures under cover of gluteus maximus. Fine. Yes. Now moving to the next sub question. Sorry, next spotters question. Actually, the knee joint. Okay, the knee joint has been exposed here. Okay, so the question is, identify the pinned structure. Actually, you are able to see one ligament of the knee joint, okay, which is moving like this, okay. So this is the anterior view. So which ligament is pinned here? So the pinned structure here is anterior cruciate ligament, okay. Anterior cruciate ligament. That is the answer for this question. Anterior cruciate ligament is pinned here. Posterior cruciate ligament will not be kept in the spotters because it is located at a deeper level behind this, okay. So anterior cruciate ligament is the answer for this question, okay. And the sub question may be attachments. What is the attachments of the pinned structure? Otherwise function. Any one may be a sub question, okay. So what is the attachments and function of the anterior cruciate ligament? Yes, you can see in this diagram. So in the tibia, in the upper end of tibia bone, we have particular area between the medial condyle and lateral condyle called as intercondylar area, okay. Intercondylar area of tibia, okay. So that is the site of origin, okay, or lower attachment of ACL. Number 1 is ACL in this diagram. Number 2 is PCL, posterior cruciate ligament, okay. So what is the attachment of ACL? Yes, below it is attached to the anterior part of the intercondylar area of tibia. What about the upper attachment of the anterior cruciate ligament? Yes, it is attached to the femur bone. In which condyle of femur? Lateral condyle of the femur, okay. So in this diagram, which is lateral, which is medial, you will be knowing, isn't it? So superiorly, the anterior cruciate ligament is attached to the lateral condyle of femur bone. Which is surface of the lateral condyle of femur, specifically medial surface, okay. So let's move to the spotters sub question. Attachment is the tibial attachment is anterior part of intercondylar area of tibia, okay. And the femoral, that is above, superior attachment is lateral condyle of femur. If you want to say specifically medial surface of the lateral condyle of femur, okay. Another possible sub question I have told you is function of the ACL. What is the function of ACL? Just to remember this one line, okay. ACL prevents the anterior dislocation of tibia on femur, okay. Just to take care of this one point. ACL prevents the anterior dislocation of tibia on femur bone. When the femur bone is fixed, okay, that time this ACL will prevent the anterior dislocation of tibia. So take care of the attachment and the function of ACL, okay. Yes. Sometimes instead of asking anterior cruciate ligament, they may pin this area, okay. In this diagram, they may pin this structure, okay. Are you able to see one structure here? I am marking. This is the, okay, this is the lateral meniscus, okay. So actually in this diagram, this is lateral side, medial side, okay. Lateral condyle of femur, medial condyle of femur, tibia, fibula will be here, okay. So this is the lateral meniscus, and here we will be having the medial meniscus, okay. Fine. So if the lateral meniscus are okay, so tibia bone is here, fibula will be here, okay. Fibula will be here, fine, not here, okay. Fibula is the lateral bone of the leg, okay. So if the lateral meniscus or medial meniscus also may be pinned, okay. So take care which structure is pinned. So in this diagram also you can see the anterior cruciate ligament, and you can see the location of the lateral meniscus and the medial meniscus, okay. So the sub question for the lateral meniscus, medial meniscus may be, okay. Actually, this is the comparison of the medial meniscus and lateral meniscus regarding to the size, shape, and the susceptibility to injury. Go through it, okay. And the possible sub question for the menisci, if it is pinned, okay, what will be the functions of the menisci? Any idea? Yes, the menisci act as shock absorbers, okay. They act as shock absorbers. That means protecting the knee joint from injury, okay. And also the menisci increase the concavities of the tibial condyles for better articulation with the femoral condyles, okay. Fine. These are the two functions of the menisci. They act as shock absorbers so that they protect the knee joint from injury, and also they increase the concavities of the tibial condyles for better articulation with the condyles of the femur. Fine. And another possible subcousin for menisci is they are made up of what type of cartilage? Any idea? Yes, menisci are made up of fibrocartilage. Okay, menisci are made up of fibrocartilage. Fibrocartilage. Okay, actually they are semilunar cartilages, semilunar shaped cartilages. They are made up of fibrocartilage. Fine. Yes. Let's move to the next subcousin. Okay. So in this image, actually you are seeing the lower part of thigh and upper part of leg. Okay, upper part of leg, lower part of thigh and upper part of leg. Front. Okay, front view, anterior view. So actually this is the location of patella bone. Okay, this is the location of patella bone. Okay, which is located just in front of knee joint. Just in front of knee joint, we have the patella bone, isn't it? So are you able to see one structure is pinned here? Isn't it? Which is extending from the patella bone to the upper end of tibia. This is the tibia bone, upper end of tibia, where we have the projection called as tibial tuberosity. So can you tell me the pinned structure here? So what is the identification? Fine. What is the identification? Identify the pinned structure. The pinned structure is ligamentum patellae. Okay, ligamentum patellae or patellar ligament. Okay, and the subcousin may be, okay, how it is formed. Okay, how it is formed. Okay, how it is derived or formed. Our usual subcousin is extent or attachments. Extent or attachments of the pinned structure. Okay, and function. Any one may be a subcousin. Okay, so I think you will be knowing. Just above the patella, you are seeing the quadriceps tendon. Okay, quadriceps tendon. Okay, so see in this diagram, this is the patella bone. Okay, so the quadriceps tendon, if you want to say specifically, quadriceps femoris tendon is getting inserted into the base of the patella. A part of quadriceps femoris tendon extends from the apex of the patella to the tibial tuberosity, which is called as ligamentum patellae. So ligamentum patellae, the first subcousin formation is, it is a part of quadriceps femoris tendon. Second cousin, extent or attachments. What? It is extending from apex of patella to the tibial tuberosity. Fine. And what is the function of the ligamentum patellae? You know, it is a part of quadriceps tendon which causes extension of knee joint. Fine. Yes. Now, so take care of this quadriceps femoris. The four parts or four components of quadriceps femoris: rectus femoris and three vastus muscles: vastus medialis, lateralis, intermedius. Okay, this may be a short notes. Okay, so that's why I have taken here. So please try to go through the origin, insertion, nerve supply, and action of the four parts of quadriceps femoris muscle. Okay. Yes. Coming to the final question of the part 1 spotters. Okay, so in this diagram, you are seeing the back of thigh. Okay, back of thigh, lower part of back of thigh, and upper part of leg. You are able to see upper part of leg, back of. Okay, posterior view again. Okay, it's the posterior view, back of thigh and the back of leg. Okay, you are seeing. So here we have one diamond shaped, okay, depression at the back of knee joint called as popliteal fossa, isn't it? Popliteal fossa. So are you able to see one structure is tied within the popliteal fossa? Anybody? What is the tied structure? Yes, it is popliteal artery. Okay, popliteal artery is tied here. Okay, the tied structure is popliteal artery. You can see in this diagram in a clear view. Okay, magnified view. So this is the popliteal artery. This is the popliteal vein. Okay, and this is the sciatic nerve, which will divide into two branches. Okay, within the popliteal fossa, namely tibial nerve and common peroneal nerve. Okay, so popliteal artery is pinned. Sorry, popliteal artery is tied here. So what will be the subcousin for the popliteal artery? Okay, extent. It may be extent, or it may be branches, or it may be applied. Similar to the femoral artery, the three possible subcousin for the popliteal artery will be extent, branches, applied. Okay, so what is the extent of the popliteal artery? Yes, as you see in this image, at the adductor hiatus, the femoral artery is the one which continues as popliteal artery. So it is the continuation of the femoral artery at the adductor hiatus. Okay, and as you see in this diagram, the popliteal artery is running almost vertically downwards, isn't it? And when it reaches the lower border of popliteus muscle, okay, when it reaches the lower border of the popliteus muscle, the popliteal artery divides into two arteries. One is anterior tibial and another one is posterior tibial arteries. Okay, fine. So what is the extent of popliteal artery? Yes, it extends from the adductor hiatus to the lower border of popliteus muscle. Okay, it is the continuation of femoral artery, and finally at the lower border of popliteus it divides into anterior and the posterior tibial arteries. Okay, so here I have mentioned the 5 main branches of the popliteal artery. Go through them. Okay, superior medial genicular, superior lateral genicular, then middle genicular, then inferior medial, inferior lateral, and you know the 2 terminal branches. Okay, so these are the various branches of popliteal artery. Okay, all these branches will be supplying the knee joint, mainly knee joint. Okay, superior medial, superior lateral genicular arteries. Okay, then inferior medial, inferior lateral genicular arteries, middle genicular, and these are the 2 terminal branches. One is anterior tibial. Okay, another one is posterior tibial artery. Fine. Then coming to the another possible sub-question for the popliteal artery is applied aspect. Okay, actually within the popliteal fossa, it is the deepest content. Okay, popliteal artery. So the palpation of popliteal artery is so difficult, very difficult. So as you see in this diagram image, the palpation of popliteal artery, you have to flex the knee joint of the patient or subject. Okay, you have to flex the knee joint, then only you can palpate the pulsation of popliteal artery. Okay, and compared to other peripheral arteries, in popliteal artery, aneurysm is relatively common. Aneurysm of popliteal artery is relatively common. Okay, so one is palpation of popliteal artery, another one is aneurysm of popliteal artery. Okay, fine. That's the end of the spotter session part 1. Thank you all.